Welcome to the Doctor Coffee Podcast, Dr. Tracey Ferreira.
Hi, Simon. Thanks so much for having me. It's such a privilege to be able to represent my speciality.
We're so glad that you accepted the invitation. I'm sure we're going to learn a lot from you today. So, right off the bat, when we start our podcast conversations with our guests, we'd like to ask you about your junior doctor years. So, where you did medical school and then where you did internship in ComServe. Tell us about your experience.
So I am a Witsie. I did my undergrad at Wits Medical School. I graduated in 2013, then completed my 2 years of internship at Chris Hani Baragwanath, Paradise, and did my community service at Tambo Memorial Hospital in Boksburg and Joburg. Did a full year of anesthesia
Oh, wow.
in my community service year. So I was very privileged to be able to stay in that department for the entire year. So that was my junior doctor years.
Awesome. So, it sounds like having been a Vitsy, you had been exposed to Barra and you knew that Barra was where you wanted to go for internship.
Absolutely. Yeah, it was my first choice. I was still in the era of, they used to say if there was a B anywhere on your internship application form, you were getting sent to Barra. There was ample space. Not many people actually wanted to go there. So there wasn't as much competition for it back then, but it was definitely my first choice. And I'm really so glad that I did. I just learned so much and such a great experience.
Awesome. And going into community service, did you already know kind of the trajectory you wanted to take? Did you know you wanted to go into anesthetics?
So not really. I had during internship, I actually always thought I would do cardiology, and I think my internal medicine rotation decided that I was not willing to go through 4 years of internal med and TB wards to get to
Yeah.
cardiology. So I still kind of enjoyed the critical care aspect. I knew that I liked all things critical care. I had a really strong interest in emergency medicine. But also had a little bit of an interest in anesthetics, wanted to find out more when the hospital contacted me, when Tambo contacted me and said, which department would you prefer? I actually said emergency medicine, and Tambo is quite well known for their ED. I think they have registrars rotating through there. So I was quite excited about that. And then surprise, surprise, you've got anesthetics for the whole year. But in retrospect, that was exactly what was meant to be. I really found a love for anesthesia. It still ticked all the boxes in terms of having a lot of the critical care aspects, physiology, which I absolutely love. So yeah, and every time I walked into the ED at Tambo, I would kind of get this feeling like, oh, I don't really want to be here for the rest of my life. So I think it was great. It really, you know how they say your specialty sometimes chooses you, which is kind of exactly what happened to me, but all worked out exactly the way it should have.
And at any points were they saying, you've already done 6 months of anesthetics. If you want to, you can choose something else? Or was it you were set to that 12 months?
They didn't give us the option of changing. So at Tambo, and as far as I know, it still is the case, they expect you to be in whichever specialty you go into for the entire year. I didn't exactly go and bang on doors and say I want to change. After the first 6 months, I was really happy where I was. But yeah, at Tambo, it's 1 year, and this is where you are, and this is where you'll stay.
And talk us through the transition from being an intern at a very large tertiary hospital like Chris Hani Baragwanath, then going to community service to not quite, I wouldn't say it's like a lower level of care. It's still a very
Mm,
academic hospital. There's still, like you said, registrars rotating through, medical students come through, but it's definitely a district level hospital, or I think it might
mm.
be regional level hospital. What was it like going from that really big hospital to now running in just one lane, running in one silo, one speciality, and then at a lower level of care?
So it was challenging, I must say. Anyone who's been at Barrow will know that it is filled with a lot of very hardworking, driven people who are there to get the job done. We've got some of the top specialists in the country, in the world at Barra. And so working under people like that and then having to transition to an environment where there are mainly career medical officers in the departments who are not necessarily there to further their careers. They've found their spot and that's where they are. It's not the case with everyone, but in general, that's what I found there. Um, it was challenging. It was a completely different mindset, but I managed to find my people. So there was a group of medical officers at Tambo who were a few years ahead of me, who were on the path to trying to getting into a reg post, and they took me under their wing. There were 4 community service doctors who I'm still in touch with today, and 3 of us are specialists now. So they took us under their wing. They taught us the right way to do things, to stand our ground, to not take the shortcuts. They were there for the stab hearts at midnight when we just thought, can't do this on my own. So I think you've got to find your people wherever you go, and really latch onto them, learn from them, because there's always going to be a lot of people who aren't your people. And it's very easy to get frustrated in those environments because you're not all of the same mindset. So that was the challenge, but that's how I overcame it, was to just look for those people who I felt had similar values, similar vision to me. And yeah, those people are still some of my mentors today. They went on to get their edge posts a few years ahead of me, and are also now specialists a few years ahead of me. So yeah.
Wow, great. And it just comes down to the people factor, right? You know, as scientific as medicine is, we're still human beings. There's still the soft side of medicine.
Exactly. Yeah. You can't get through it without your people.
Dr. Ferreira, so doing anesthetics then, at some point you realized this is definitely for me. So let's talk about what it was that drew you to anesthetics. You have mentioned some of the aspects that were very similar to emergency medicine, so like some of the skills and some of the settings that you work in. What is it about anesthetics that grabbed you and gripped you? This is now your opportunity to kind of hunt your speciality, so that all the aspiring medical students are like, okay, this is what I want to do.
Yeah. So like I said, the critical care aspect really drew me in, and there's jokes about anesthetists sitting in the corner doing Sudoku and taking numerous coffee breaks, which we do take numerous coffee breaks. But it's actually, there are moments when there's a big adrenaline rush. You know, there's critical care moments. It keeps you on your toes, and we talk about it like flying a plane, where the takeoff and the landing are crucial, and in between you cruising. And so there are those moments, and that's what I really enjoyed, and that it wasn't continuously go go go. There were moments of calm and peace where you could get yourself together, but also a lot of the time need to be on your toes, on top of your game. Yeah, my A-type personality also fits very well with anesthesia. So we are planners. We like to make sure that we are prepared for any eventuality. So you will find us in theatre before our list starts, making sure everything is working, making sure we have all the drugs we need. And I really liked that aspect of how it wasn't out of control like in the ED. I had an opportunity to make sure things were working and be prepared for whatever might come my way. And then just the variety in anesthetics. You can go from doping a 600-gram neonate to the stab heart in the middle of the night, to cardiothoracic anesthesia, to sedations on a colonoscopy list. There's so much variety. It never gets boring. We are involved a lot in pain medicine. So there's even some anesthetists who are now solely running pain clinics. So there's that whole aspect of it. So it's just such a broad field that, like I said, you never really get bored. We are the perioperative physicians. So it's not just about big syringe, small syringe, patient sleeping. You are responsible for making sure that your patient is optimized. So you've got a role pre-operatively to make sure that your patient's optimized and you're happy with them coming for the anesthetic. You've got a role post-operatively in making sure their pain is under control and that they have recovered well from their surgery. And then intraoperatively, like I said, it's not just about making sure they're sleeping. You are essentially making sure that their physiology is stable throughout the surgery.
Yes.
So you'll see in shows like Grey's Anatomy, they like to portray that the surgeon is in control of everything and they're screaming, push the epi. But in reality, the surgeon is very focused on their surgical field, as it should be, and you are responsible for making sure that every other aspect of the patient is doing well, their cardiovascular physiology, their respiratory physiology, their fluid balance. So it's juggling a lot of balls all at the same time. And yeah, that just really is what attracted me to anesthetics, and still is what I love about it.
Awesome. So now, having said the highlights of your career and so far in anesthetics, what are some of the downsides of anesthesia? What are the lowlights? Because every reg time is hard. Every specialty will have its difficult moments. What are some of the moments where you go like, oh, okay, if it was like this every day, I don't know if this is what I'd want to do.
Absolutely, yeah. So I think in terms of the specialization process and getting to be a specialist anesthesiologist, one of the toughest hurdles that a lot of people struggle with is the Part 1 exam, which I'm sure we'll chat about a bit later, but it's an incredibly tough exam. And I think it's honestly one of the stumbling blocks that stop a lot of people from becoming specialists. And then the one thing that I have struggled with in anesthesia, that some people probably find it a plus, but is that there's not very much continuity of care. So you will see a patient usually once off. You might follow them up for a day or two post-op if you are in the state sector and you're kind of at the same hospital every day. In private, you might give them a call afterwards to see how they're feeling. But then that's it. That's kind of the end of the line for you and your patient. And so I have sometimes struggled with wondering how they're doing, what's the outcome been if they had a massive surgery, or if we did a biopsy, I wonder if it was cancer. So that is something that you have to kind of get used to, is living with uncertainty about the long-term outcome of some of your patients. But some people also see that as a plus, as, I don't have to see this patient 100 times in clinics and that kind of thing. I think those are obviously reg time is tough, but any reg time is tough. I think that anesthetics is probably one of the better registrar times, in terms of we don't do 36-hour calls, we do 16-hour calls. So it does require a lot of sacrifice to specialize, and you've got to be willing to make those sacrifices and to put the work in. But that is going to be the case with any specialization.
Well, it's a really insightful and helpful answer. I'm sure a lot of people are going to get a lot of clarity from that. So now talk us about the transition. We'll touch on the actual specializing and going into Part 1 and stuff. Talk about the transition from working in a state sector to now kind of being in private. Have you attached yourself to certain surgeons? Like, how's it gone navigating the world of trying to find work where there's no guarantees?
Yeah, so I think as far as anesthetics goes, we probably have an easier transition into private practice, because we don't have to set up an actual physical practice. You are the practice. So there's not this huge outlay of cash to set up an actual practice. So that is one of the great things. I actually felt like my reg time inadequately prepared me for the world of private practice.
Wow.
There is so much that we do, for example, sedation for colonoscopies, gastroscopies, that kind of thing. I never did one single one of those in my specialization years, and it forms a large part of my work now in private practice. So there was actually a huge learning curve, in spite of thinking that once you've written those exams, you're now on top of your game and you know everything there is to know. I had to learn a lot of new things and kind of tweak things and perfect my art, so to speak, in a lot of those areas that I hadn't been exposed to before. But I have really been very fortunate. I got invited to join a group practice in private. So I'm with the Delta Anesthesia practice, which is just an awesome group of other specialist anesthesiologists, many of them far more experienced than me, who I've been able to call on if I need advice or help, clinically, and also on the business side of things, like how do I bill for this procedure kind of thing. So it's really helped smooth the transition for me. I still work for myself essentially, but I just have this group behind me to help support me, and we all cover each other's surgeons after hours, so I don't have to be on call 24/7, 365. I can call on the other anesthesiologists in my group to cover my surgeons if they might have emergencies. So yeah, and then it's also been a lot about the relationships that I actually built during my registrar time. So a lot of the surgeons that I'm working with now, we were registrars together at Wits. And so you kind of foster those relationships there, and you need to remember that your reputation is being built from day one. If I was the kind of reg that was lazy and slacking and trying to cancel every second case, I don't think those surgeons would want to work with me now. So it really, I think it was a big benefit that I always tried to be my best as a reg. And yeah, so those relationships have now carried through into my private practice.
Awesome. Now, if I can take you back a little bit, because you're talking about the value of relationships and the importance of building those bonds around shared experience as registrars, if I could take you back to your med school days, do you still have any friends from your med school time? I believe you were straight from school into varsity, so you were what we would call a mainstreamer in medicine. You weren't a GEMPA or anything at Wits. Do you still have friends from med school time?
Absolutely, yes. I have a group of very close friends. There's 5 of us. We are spread all across the world, but we have a WhatsApp group that we communicate on almost daily. And yeah, they like family to me. And those relationships I built in med school, I think will definitely be lifelong friendships.
Awesome. And that leads me to my question of whether or not you still think it's worth studying medicine as a career path. If anyone's an aspiring medical doctor or anesthesiologist listening to this podcast, is it kind of like get out while you can, or is it get in while you can?
Oh, you know what, Simon? I think we all have our moments where we think, goodness, I should have chosen a 9 to 5. Why did I choose this path? But truthfully, the answer is absolutely, it's a decision I would make over and over again. It is so worth it. It's such a privilege to be in this job. It's mentally stimulating. It's interesting. Like I said, it's a privilege being able to care for patients. And if it's something that you think you want to do, absolutely 100% go for it. Like I said, it's going to be hard, and you will definitely have days where you think, wow, I'm not actually sure that this was worth it. But at the end of the day, and especially now where I'm at in my career, I can say I'm so happy with the decision I made to do this.
7th Star has made a name for itself by providing an array of courses meticulously designed to meet the needs of aspiring students across South Africa. They provide a helping hand to those with aspirations for a career in medicine, ensuring they have the knowledge, the skills, and the confidence they need to succeed. They recently opened up registrations for their highly successful GEMP course. This program has been painstakingly designed to prepare students for the Wits Additional Placement Test, better known as the WAPT, the gateway to studying medicine at Wits University. The course offers contact lessons at their Centurion campus, as well as online, live stream lessons for students scattered all around the country. If you need more information or to sign up, visit their website at 7star.co.za. For further details, you can also reach out to Johan Mitton on 076 208 5713.
We're back now with Dr. Ferreira, and we're going to be asking her about what's the exams for anesthesiology or anesthetics. Which is it?
It's both.
It's both, right?
Technically, if you're an anesthesiologist, it means you're a specialist with a fellowship. If you're an anaesthetist, you're someone that administers anesthesia. So you may be a GP anaesthetist or an anesthesiologist.
Oh, wow. And I actually genuinely didn't know that that was the distinction. So I'm so glad that no one has bombed me over their head for calling them an anaesthetist when they've completed their the FCA.
It's okay. We generally anesthetists do not have big egos. So we don't mind what we're called.
Okay, fantastic. Let's talk about the exams, the FCA exam. So there's part 1. And my understanding is that there's quite a lot of like basic physiology. Well, not basic. I mean, it's very complicated, but there's physiology and anatomy components. So talk us through what goes into your part 1 exam.
Okay, so there's 3 components. It's physics, physiology, and pharmacology. There are 2 exams for each of those. So there will be an MCQ or that kind of format, and then a longer answer question paper. So you end up writing 6 exams.
Wow.
Under those 3 headings. Yeah, like I said, it's an incredibly tough exam. I think that it's probably one of the toughest part 1s out of all the specialties. And the more difficult thing about it is that it's not necessarily all practical. So it's not stuff that you're going to learn by being in theatre doing anesthetics. You get to put into practice the pharmacology principles or the physiology principles, but really it requires you to just sit down and put in the long, hard hours and study from a textbook. And I think that is what makes it so challenging, is because obviously you're trying to do that while you're working, probably as a medical officer. And so it's a lot of long hours of studying. Most people will say that it takes at least a year of preparation.
Wow.
I probably managed, I would say, 7 months of actually really sitting down and studying. But yes, it's an incredibly tough exam. That being said, I would hate to deter anyone from giving it a go, because it is not impossible. There are thousands of people who've done it. And I also know some really, really great anaesthetists who took 2 or 3 attempts at their part 1s.
Oh.
So if you're giving it a go and you don't make it the first time, it doesn't mean that you're not going to be a great anaesthetist. Just try again. It's a tough exam. There are many people who've gone before you've had to do it more than once. It's okay. Just don't give up. Give it another go. Not impossible.
That's a really helpful answer. And just to clarify, is the pass mark as high as what they say? They say that in order to pass, you have to get above 90% or something to pass these exams.
I definitely didn't get 90%. I think it's 60% is the pass mark. Yeah, no, I don't think there are many people who would get 90%. There wouldn't be many anesthesiologists around if that was the case.
Okay, and so once you've completed part 1, and it sounds like that's something you can do while you're a medical officer. So, or is that what you have to do before you can even get a reg post?
So it varies. It kind of waxes and wanes. I would say the diploma is something that you would definitely need before you get a reg post. And for the diploma, you need 6 months of anesthetic experience at an accredited facility, and then you can write your diploma. So that is something you would need to do during your medical officer time. As far as the part 1 goes, like I said, it waxes and wanes. So sometimes there are seasons where there are ample reg posts available and not many applicants with part 1s, and then you might get a post without your part 1s. And then there's other times where there's very few posts and it's far more competitive, and then you do need your part 1s. If you want to guarantee yourself a reg post, you would need to have your part 1s. So then it is something that you need to write during your MO time, and actually not a bad idea to write it before your registrar time starts, because once you start your reg time, you hit the ground running with specialist rotations, and you're going to have a lot less time to actually put in the work for those part 1s.
Sure. So having done part 1, you're now an anesthetics reg. What is your day-to-day like? If you can cast your mind back to that reg time, what was it like day-to-day? What was your week like in the state sector as a registrar in anesthetics?
So in the state sector, it's quite different to private. You would have seen your pre-meds the day before. So the theatre lists get booked the day before. You would go in the afternoon and see all your patients and order whichever bloods you might need, maybe ask for a chest x-ray or an ECG, decide if you're going to need an ICU bed booked for that patient, that kind of thing. So that preparation all happens the day before. You'll then get to work, and like I said, we're all about preparation. So the first thing you do is go to theatre, check your machine, check your drugs, make sure you've got everything you might need, and then the rest of your day really depends on what list you're doing. Sometimes you might be in a 6-hour Whipple, and sometimes you might be in a high turnover tonsils list where you're going to be doing 8 2-year-olds for adenoids and tonsils. So your days vary so much depending on which list you're on, which is one of my favorite things about anesthetics, is that no day is the same. And then when your day's done, you will go and see your pre-meds for the next day. So that's a day in the state sector. In private, patients usually arrive on the day of surgery unless they are ill and already admitted to hospital. So that means usually a very early start for us. if your list is starting at 7:30, sometimes you might need to be at the hospital at 6 a.m. to start seeing all your patients and make sure they're optimized. Obviously, things happen a lot quicker there. So if you do need bloods or an x-ray, it can happen within the hour. It's not like at Barrow where it might take days. And then again, it's the preparation in theatre, and then your day goes depending on what your list is. And one of my favorite things about private is going to see the patients in the ward afterwards, which I must be honest, I didn't do much as a registrar, and I wish I had. I wish my consultants had said to me, do this. But you're just so exhausted and you're so keen to get home, and you've still got to see tomorrow's pre-med, so you don't want to double up the amount of patients you have to see by going to see today's patients. But it's really so rewarding to go and follow up at the end of the day and see that they are pain-free and comfortable and stable and happy. Yeah.
So having worked and especially drawing the contrasts between state and private, if I can draw you for some kind of perspective or opinion on the NHI bill and how that might influence billing and how people access care. I think with anesthetics, it's a little bit different than other types of medicine because it is so specialized and you know exactly what the money is going towards.
Yes.
But how would NHI affect the career of anesthetics or anesthesiologists, excuse me, in South Africa?
Well, I wish I knew for sure. It would make me feel a lot more at ease because I do want to stay in South Africa. I don't have any plans to leave. And so it's definitely a source of anxiety for a lot of us. And while I absolutely 100% recognize that our healthcare system is in a mess and something needs to change and our population is not getting the healthcare that they deserve. So I definitely see the need for a new system. I think we all know why we're feeling anxious about the way it's going to go and how the funds are going to be managed and that kind of thing. I said to a colleague the other day, more than worrying about my job, I'm quite worried about the kind of access to healthcare that my family will have. But I assume that it would be like we would need to be employed by the state once again, maybe similar to the consultants that are still employed by the state, and be allocated where we're told to be allocated. Like I said, I wish I knew. I'm trying to remain calm about it. I think it's still many, many years away. And hopefully we all have a chance to just have input into the way we think we can best serve our patients and the system. The aim of the system is that,
Awesome. I realize that might have been a bit of a hospital pass. So apologies for throwing you on the spot.
It's okay.
We'd love to have you on a future episode of the podcast to talk about motherhood and medicine. But just for the benefits of our audience listening to the podcast on this episode, tell us a little bit about your journey specializing and practicing medicine, and then also trying to have a life outside of medicine, what that looked like for you.
So yes, I am a mom. I have 2 beautiful kids, a 4-year-old and a 1-year-old. So I have a lot of life outside of medicine. It's challenging, but it's also been the greatest blessing to me to have perspective that this isn't everything. Because of course, medicine is a career that is all consuming. It's who we are. It's not a job, it's who we are. And so it's very easy to get tunnel vision and to think that this is all that really matters in life. And so I think having children allowed me to see that there's so much more to me than being a doctor, being an anesthesiologist. So as hard as it is, it's really been a blessing. Studying when I was studying for my part 2s, my final exams, I was pregnant with my daughter Harper, and my son Roman was 2 years old. And so that was short. My husband and I look back and just think, how did we survive? And I don't really know. There was definitely supernatural influence in getting us through that season of our lives. But again, I think it was a blessing. I had to take my study breaks because I had to go and put my son to bed. And it kind of forced me to have that balance, where I've seen with a lot of my colleagues who aren't forced to have that balance, burnout happens very quickly. And so it's all about prioritizing, just like anything else in life. There were times when my studies had to take priority, and I had to say to my husband and my son, I'm going to go and lock myself in this room for a few hours and I'll see you when I come out. And then there were times when my family needed me more and I prioritized them. And at the end of the day, it all turned out okay. I passed the exam. And yeah, I think just you need to know which balls you can put down at which time while you're juggling. Sometimes you have to keep some balls in the air and you can put others down. And it's just about getting to know when that time is.
Yes, and that's a great answer. And did you ever consciously sit down and say, right, this is the right season to have a family and to have kids? Because you had obviously been married beforehand, before you started Reg Time. Did you at all delay having children until such a time, or were you just waiting for that moment? It's like, okay, now we go for it.
Yeah, so I got married in my second year of internship. And we did wait. Because you know how medical officer posts are normally in 6-month stints. So when you're in community service or a medical officer, there's a lot of uncertainty. And I just didn't really want to have kids without a little bit of job security. So we did wait till I was in a registrar post, knowing that at least I would have a job for 4 years, much to my department's horror, I'm sure. But yeah, I think there's never a perfect time. Everyone is in a different position financially, age-wise. You've got to consider, there's doctors that have thought they'll wait till they're done specializing and then struggle to fall pregnant because age definitely is a factor. So I don't think that there's a perfect time. I think it's a very personal, individual thing. I'm so happy the way it worked out for me that I'm done having kids and my specializing is done, and I can really focus on building my private practice now without having to take another 4 months off. So Reg Time, and like I say, HR will probably hate me for saying this, so I hope there's no one in the Department of Health listening, but Reg Time is really a great time to have kids because you've got that 4 years, you're going to be employed and you're going to get paid maternity leave. And then when you're done with your Reg Time, you've got your family and you can move on with your life.
A word to the wise listening to this podcast. Dr. Ferreira, it's been an absolute pleasure to have you on the podcast so far. We're coming into land, so I'm going to ask you some final closing questions and then give you an opportunity to share whatever you'd like to our audience of medical students and junior doctors. But are there any key books or resources that if you look back, you're like, oh, if I had only known this earlier, or if I had read this book earlier, it would have given me so much perspective, wisdom, encouragement. Is there anything you can recommend that we read?
So the Anesthesia Bible, so to speak, would probably be Morgan and McHale. So that's the textbook that the whole DA, Diploma of Anesthetics, is based on. And really the only book that you need to pass the DA, and you don't even need the whole thing. You can leave out the neurosurgery and cardiothoracic surgery chapters. That book, yeah, I would say if you want to buy one anesthetic textbook, go and buy Morgan and McHale. And then I wish I had got into podcasts sooner. So when I was studying for part 2s, I would listen to podcasts on my way to and from work. And I really wish that I had got into them earlier in my Reg Time, because it's an opportunity to just hear what the rest of the world is doing and listen to topics that you might not necessarily have covered. And so there are many anesthetic podcasts. ACRAC was my favorite, ACC, RACC. So if you're looking for a good something to listen to while you're driving, that's my recommendation.
Awesome. We'll link to that in the show notes for this episode so that the listeners can find it easily. Your recommended podcast to listen to for anesthetics. One final thought from you, any encouragement, any motivation, any inspiration for junior doctors and medical students?
I think just to say that it's all worth it. There are going to be so many days in your path to becoming a doctor and then to becoming a specialist, if that's what you choose, where you wonder if it's worth it. And I can say, speaking from the other side of it now, that it absolutely is worth it. Doing what you love every day, knowing that you put in the hard work to get here, and just being able to build the career you want. You know, medicine doesn't have to dictate your career. It does for very many years, but once you get here, it's building the life you want and building the career you want. And so keep pushing. It's worth it. It's worth getting through the hard days. Like I said, get your people around you, and there's light at the end of the tunnel. Absolutely.
Thank you so much, Dr. Tracey Ferreira, for appearing on this episode of the Dr. Coffee podcast. We appreciate you sharing from your personal experiences, your perspectives, the ups and downs of anesthetics to become a certified anesthesiologist. We learned a new word today. Thank you for your time and for investing into the future of medicine in South Africa.
It's a pleasure, Simon. Thanks so much for having me.
That's it for this week's episode. I'd like to take a moment to direct you briefly to our Linktree URL, which you can find in the show notes for this episode, as well as in the bio of our Instagram page at Dr. Coffee ZA. There you'll find links to our sponsors on this episode, IndemniMed by Money and Medicine, and 7th Star Tuition, as well as a Google form you can complete if you're interested in working with the Dr. Coffee podcast. Thank you for your support, and we'll see you in episode 41.